we now want to go to this second session where we will be on a discussion of global health financing in mental health and addiction. What needs to be done? And for us to have the panelists on the podium, we want to call upon our first panelist, who is our first panelist we are going to call on stage.
Dr. Joel Mubirigi ni umuyobozi wa Partners in Health. Karibu kuri stage.
Let's give a round of applause to Dr. Joel Mubirigi on the stage. Thank you. Our next speaker, our next panelist is called Aflodis
Kagaba,
the HDI Executive Director. Let's give a round of applause as they go to the stage. Youth, these people are very important. Very important is just to have them even just for 1 minute in their same presence, same room. It's an honor. So we give them much respect. And there is also Miss Erem Adseva, who is going to be joining us live from Turkey virtually. We'll connect them on screen very soon. And also on the fourth panelist, we are going to have Mr. Vincent
Munyeshaka,
who is also from BDF, Chief Executive Officer, or the representative present. Yes. Let's give a round of applause to the BDF. And Beauty, I don't know why this conference is much honored by Their Excellency. We have got His Excellency, Dr. Nabit Kapoor, founder of Peaceful Minds Foundation in India, all the way from India. They have come. Let's give a round of applause to His Excellency, Dr. Nabit Kapoor, to come on the podium.
mutwemerere rero twakire n'umuyobozi w'iki kiganiro ni Dinamo Ndacyayisenga, ikaze kuri stage.
Let's give a round of applause to Mr. Dynamo Ndacyayisenga to moderate this session. Thank you. I hope there is supposed to be some microphones. They are already there. Thank you so much. The other microphones are on the tables. Thank you.
Good morning once again. It's my pleasure to have good speakers like these experts, different domains, especially who are supporting mental health and addictions. And first of all, let me have a slight introduction, starting from Dr. Kagaba. As you know, Dr. Kagaba is a physician and a human rights advocate with over 15 years of experience working in the non-profit sector organization, especially his organization called Health Development Initiative. Dr. Kagaba has an extensive knowledge of public health, health policy and advocacy, project management, HIV/AIDS, SRHRL, and human rights. He serves as Executive Director of Health Development Initiative, an organization he co-founded in 2005 to promote access to health and inclusive development of marginalized and vulnerable group. At HDI, Dr. Kagaba has contributed to the elaboration of a number of national and regional health policies and successfully led several advocacy efforts to advance health and human rights for PLWHA, women, young people, and key population. Dr. Kagaba is currently the chairperson of East African Health Platform, a regional organization bringing together diverse stakeholders to facilitate the growth and effective contribution of non-state actors in health toward regional health integration for the benefits of East African population. He holds a master's level from School of Medicine, National University of Rwanda, and Master's of Science in International Health Policy and Management from Brandeis University, United States of America. So it's our pleasure to have Dr. Kagaba, proud of him. So let me introduce also Dr. Joel. Dr. Joel Mubigi is a passionate physician and a global health expert with an extensive experience in healthcare delivery of more than 10 years. He has held senior management positions both in the public and NGO sectors. He is currently the executive director of Partners in Health, Inshuti mu Buzima, an international NGO that supports the government of Rwanda in its efforts to strengthen the healthcare system. Dr. Joel has also served as medical advisor to the Ministry of Health National Human Resources for Health Program, where he supports the government of Rwanda to improve medical training programs at the University of Rwanda. Clap to him, please. Dr. Nabit Kapoor is a Nobel Peace Prize nominee 2022, is a crusader of mental health and multilateral diplomacy, who is currently serving as the senior advisor to the government of Somaliland and Liberia, working on the main agenda of well-being diplomacy. He was the only independent Indian candidate for United Nations Secretary General election 2021, and now for 2026. He is also the senior advisor to the International Society of Diplomats in Greece and the High Representative for Wellness for the Intergovernmental Organizations, IGO, in Spain. Recently, he was nominated as the board of directors to the private office of the Highness Sheikh Majid Rashid Al Muwala. His main professional interests include mental health advocacy, well-being diplomacy, international affairs, diplomacy, and global peace. Clap to him, please. And as they say, we have someone who will join us virtually, Ilem Adzeva. She was graduated from the Department of Psychology at Ankara, Yerdemir Beyazit University in 2016. She received a master's degree in clinical psychology at the same university in 2019. She has recently worked at Green Crescent Consultants Center, YEDAM, as a clinical psychologist for over 3 years. She provides individual psychotherapies and family interviews. Please clap to her. As you see, we have experts in mental health and addictions, but not only that, but also in advocacy to health. So, this is our opportunity to see what is coming from these experts, as we have introduced their background, and they have contributed a lot to make sure that mental health and addictions are coming to agenda, even up to date. If I start, Dr. Joel, good morning again.
Good morning, Dinamo.
Okay.
Good morning, everyone.
So, Dr. Joel, as you see, the COVID-19 pandemic has devastated all corners of life, especially the mental health of young people and children. How can existing frameworks work together to alleviate the burden of mental health, to ensure access to mental health care services and rehabilitation of those suffering from mental health issues? Thank you.
Thank you. Thank you very much, Dinamo, for this good and important question. Before I answer that, I would like to thank the organizers for this important meeting. I remember meeting with Dr. Niringwaya and Memory, discussing about this conference and its importance, and it's a real joy to see it materialized and happening. Regarding your question, I think if there is, among many things that COVID-19 pandemic have taught us, it has actually shed a light or put in front of everyone what have already been complex issues of inequality in health access, complex issues of imbalance health financing systems, complex issues of social suffering and disturbance in different communities. And I think the pandemic, by the fact of being global and by the fact of touching all layers of social classes and social institutions, have magnified that so that all of us could see it. And I think the greatest thing we can do as human beings is not to forget those lessons. It's actually to now rethink how we design health systems, rethink how we prioritize in order to do much better than what we have been doing in the past decades. And going back, this is really the overall picture. But specifically on mental health, it has affected not only, it has not only shown or helped us to see the gap that are existing in mental health services, but it has also amplified the demand in many ways. We saw the increase in home-based violence, where families were obliged to live locked in a place without moving, and you could see abuses of children, girls, and so forth. That was magnified, you could see that. It has also affected the prospect of future and hope in many ways. People losing jobs, people not being able to feed themselves, people not being able to go to what give them a sense of identity, which will be their community, meeting with friends and families and so forth. So all of those things were completely disrupted and have increased in a way that even today, I'm afraid that we have not yet realized the demand in mental health care. I think it has impacted that. We have a sense of it. Each one of us have been affected in a way. We know people that have been affected in a way, but I think we have not yet realized to which extent that the demand for the services around mental health have been impacted by the COVID-19 pandemic. That said, that demand that is increasing is coming in a context, and this is to go back in the topic that we are discussing, is coming in a context on a very underfinanced aspect of health service, which is mental health. So COVID have shown the gap, it has increased the demand, but all of this gap and demand is already on a basic already of many years of under-financing services. That's one. Second, the demand has increased, the gap have been shown by the COVID-19, but all of this is also coming on a context of many years of medicalized mental health services, which have not been successful up to date. So you have an under-finance type of service, and a type of service that have been run in a wrong way, let me put it that way, for many years, in a wrong way that is very medicalized, in a wrong way that have ignored the role of the community, in a wrong way that have ignored the role of culture, in a wrong way that have ignored the sense of belief and value that people have. And all of this constitute our mental health wellness. You know, the faith of people, the religions, and all those aspects. So I think, to me, I would say, to answer your question, I think COVID-19 pandemic have put us in a pressure to rethink things urgently, to rethink how we deliver health services, and also to rethink how to finance it. You know, if you look at the health system in general, not only mental health, you know, we all know about the Bamako initiative in 1987 that have a commitment of every government to increase the spending in health, the government expenditure in health. But in 1987, this commitment was happening in an understanding of primary health care as a minimum package of dealing with issues of malnutrition and acute diseases of child and women and so forth. That commitment did not take in picture the growth on non-communicable diseases that we have achieved today. That commitment didn't take in picture the issues of mental health that we're discussing today. It's only, even look even later in the 2000 with the MDGs to look at maternal health, infant mortality, HIV, malaria, TB, no mention of mental health. And the good thing with MDG, at least, it have mobilized funds. Funds came to support those areas, and most of our health system today have built really to tackle and care those areas. But what it has shown as well, the under-financed aspect like mental health are not yet there, and the services are not available. The good thing with the SDGs now is that the SDGs includes mental health. But the gap of the SDGs is that the SDGs have not yet been able to mobilize funds in the same way that the MDGs did. So our fight now is, I think it will come. I mean, there's a lot of commitment globally. There's a lot of understanding with the World Health Organization, many places, of the importance of providing mental health services. So funds will come. And I think with the SDGs, funds will come. But my main concern is we need to rethink our mental health service model to make sure that when funds come, it supports an effective model that include community, that include partnership with the value based of people, like I mentioned, religions and others, that include the youth at the center. I mean, we're in a context where, you know, globally, it's estimated close to 20% of world children and adolescents have mental health conditions. So it has really to tackle those. So if we don't redefine that, I mean, this morning I was following a speech from the Prime Minister of the Barbados in this UN environmental summit that is happening, where she used an interesting sentence and say that we need to rethink things so that when we find solution, we don't find ourselves in a place where our solution is an illusion. You see, and I think rethinking that, even if we go for more funding for mental health, but we need to make sure that more funding for what type of mental health service, so that when the funding comes, it supports a system that is actually effective to tackle the youth, to tackle the social values of people that have been a gap, and COVID-19 have helped us actually see those gaps. And just to conclude, in terms of other gaps, is if there is one thing that have worked in the time of COVID-19 that have helped certain community to thrive through the pandemic and the challenges, has been that great sense of solidarity that human beings have been able to show in different contexts and different countries. And that shows us again that that's where our solutions are. And that component of solidarity in our families, in our communities, and in our entire system has to be built in as we think about mental health services. Thank you very much.
Thank you very much, Dr. Joel. To complement there are some figures which can show us how we are globally. Worldwide, 1 billion of people are living with mental health challenges and substance abuse. Secondly, specifically for Rwanda, the 1994 genocide perpetrated against the Tutsi in our country has left many mental health challenges, especially the genocide survivors. Today, we're going through the Rwanda Mental Health Survey conducted in 2018, whereby only 21% of those who met the criteria of having any mental disorder reported having utilized mental health services. Secondly, the COVID-19 pandemic lockdowns, global conflicts, and economic hardship have been substantially increasing mental health challenges, stress, trauma, and other related complex like substance abuse, especially among young people and children. So, even if treatments are done, we are still having an issue of access to mental health care services. However, they are available. This is confirming what Dr. Joel was saying. So, I would go further to think that there is a need to invest in mental health and think how collaborative efforts can contribute to mental well-being of Rwandan population and Africans, like Bishop was saying, and others. So maybe we will have some responses through other questions. Mr. Eddy, thank you for having you here, representing a BDF. You can use my microphone, please. Use mine, please. So,
hi.
Thank you for having you in this room, this important conference. I have just reserved for you a good question. As BDF representative, we know that the COVID-19 pandemic has impacted people's business, like Dr. Joel was saying, including the business of youth coming from mental rehabilitations, including rehabilitation centers and other healthcare facilities. This may impact their mental health status. How can the government, institutions, civil society organizations, or PSF support in that matter? Do you think civil society organizations like Rwanda Youth Impact do more to reduce that scourge? What is your position toward facilitating or mainstreaming for access to economic improvement? Thank you, Eddy.
Thank you so much. Good morning. Good morning. By names of Ed Muhumza. I'm not the CEO of BDF, but I am honored to have represented him. It's a huge responsibility for me. I was listening from the profiles, high profiles, people that they were reading here. The MC was reading, and I was like, wow. So it's an honor for me to represent the CEO in such a big, huge conference of this caliber. So direct on on what MC has asked. As BDF, we are in charge of access to finance. So when BDF speaks, we speak money matters. So that's why we are here. Generally, a topic like this one, or a conference like this one, it's a time it calls for different people with different interventions. That's why everyone should be involved in financing or helping people when it comes to mental health. So as BDF is a government institution funded by the government. And we have been here for almost 12 years, from 2011. And the only mandate we have is to help people access finance. However much we have priorities, but everyone is allowed to access BDF through financing. So BDF cannot do this alone. We involve partners, we involve other institutions, civil society institutions, like how Rwanda Youth has invited us here. Through different products, we have products around. We have you can read through. We have the brochures, but I'm going to speak only on the specific products that we offer when it comes to people who have gone through problems of or have issues with mental health. So we are in partnership with Rwanda National Rehabilitation Services, and that one specifically does on they have different centers like the Iwawa. I think many of the people know. So what we do, we came into agreement with the National Rehabilitation Services to help people, the graduates from those schools, from rehabilitation centers. We know that we need skills. We know that mental health need immediate support. So it's an ecosystem that involves different stakeholders. When we see people that need immediate support, that's when the RBC and other institutions come in. So for us, we see, okay, already the government has already established different institutions that help people with mental issues. So what the role of BDF is, you've been given immediate support. After all, you have been given, your skills have been developed. So what next? What next is trust. What next is trust. So we trust the graduates with money. Like they can now start working, they can start projects, income generating projects. That's how BDF comes in. So it's the whole process that the government at least established the institutions from the start. Where do you go after you have received the support you need, and then when we are there, what do we give? We give you skills. So what do you do with the skills? That's where we come in. So on the skills development, when it's done, BDF what BDF does is we can start with trainings. So when we talk about trainings, it's business training. BDF does business trainings. BDF does trainings with help of other organizations. Like we've been working with other organizations still. Rwanda Youth Impact can come on floor and we discuss how we can help a certain group that they have. So after training, at least there are some of the simple trainings that most of the youth, most of the former addicts, most of that they need. So to us, when we give those trainings, it's a way of, in case we give you money or we give you some of the materials that the toolkits that we give, that we are sure that at least you have management skills, business management skills. So from there, we have products allocated to the graduates. I'm talking, I will use the word graduates, because it's a process from the start. It's a process. So for us, when they go to rehabilitation centers, they are being trained in different areas, like tailoring, like hairdressing, like construction, so in different areas. So what we do, we provide through the partnership with former MICT and national rehabilitation centers. What we do is to provide toolkits. So how we do it, we see at least you have that skills. If you have skills, then the government should intervene. So in the morning, I was reading about the causes of mental health, and I found something interesting: poverty and debt. So if, as BDF, I think that from that cause we can intervene. So some of the people say we were addicts or we went through this situation because of we had nothing to do. So the government cannot go through the whole process and forget what people do after graduating. So we provide toolkits to those people with the skills that were trained. We even give them priority because we have a grant. If we give you maybe a machine for tailoring, then that's how we say, okay, can you at least do it as a loan? Part of it is loan and then another part is grant. So after at least you paid the loan, we say, it's okay, now you can have your project run. So that's how the government subsidizes some of the products through BDF to specific people. We have the Iwawa Graduate Toolkit that was now upgraded to leasing. Leasing is about we give you toolkits. We give tools in form of loan. Like you can have this microphone, it's yours, but it will be permanently yours when you pay back. So when you have skills, the next thing you want is not money. It's something that can help you work. Not only money, you need a tool. So that's why we provide those tools. So from there, from the tools that are specifically for people that went through vocational schools or from the rehabilitation centers that were trained in those areas, we also have another product specifically designed to all people but with a priority, youth, where we give a guarantee, a collateral when you want to get a loan from the bank. So BDF is there to cover at the maximum of 75%. So it's an opportunity for the youth. I'm happy that 80% of the loom is youth, which is good. So BDF is happy to meet this number of youth, this big number of youth. So when you already have you have an account working with banks, at least the reason that maybe that can hinder you from not getting a loan is a guarantee. Then government comes in through BDF to provide at least the maximum of 75% of the loan requested from the bank. So we have other products for those who are ready to go into agriculture. We have an agribusiness product where we have 30% of the grant and then you pay at least 70%, then government covers the rest. So it's in those products that at least you can have your projects and then sustain, like make yourself busy as you earn, instead of going back to where you were. So specifically on the Iwawa, on the Iwawa product, the toolkit, where we are giving 50% grant and 50% loan through SACCOs. By the way, BDF is located in different districts. All districts we find BDF, just to enable those good projects from every corner of the country to access these subsidized products that government facilitates. So, why I'm saying this, so far we have 96 cooperatives that have accessed finance, and those are the people that are the former addicts. So after graduating from those rehabilitation centers, they formed cooperatives, then engaged BDF to facilitate them. We gave them tools, so the cooperatives are working. So I think most of the district that took a lot of money through that channel was Gasabo, but the rest the districts located in the remote areas far from Kigali. So that shows the information, how the information flows. You cannot say that only Kigali benefit this or what. So it's about the information. Information is key. If we have a big number of people attending this conference that can at least take that message, I know we can reach out to many other youth who need that support. Yes. So access to finance is vital. Access to finance is vital, and can also help from people going back to where they were. So I'm talking specifically on the people who went through the rehabilitation centers and earn those skills. Thank you.
So thank you very much, Mr. Eddy. If I try to understand where you meant that there is a great link between healthy financing and mental health.
Yes.
So I can request for a clap of you again. So I was thinking this is a scenario of access to mental health services and financial opportunities available, especially to those who were suffering from drug addictions, and the opportunities created, or maybe other opportunities available to support those people. So my question goes to Dr. Kagaba. Why the treatments are available, but not often affordable? Nearly 2/3 of people with mental health never seek help from a health professional due to social stigma, fear of discrimination, negligence on treatment, or lack of universal health care system. I think we are together with Dr. Kagaba. Is it okay? So I have just planned for you a question. As the one who has been advocating for mental health and addictions, and you're still in that position. So, HDI has been advocating for people suffering from drug addictions and other categories of people left behind due to their life status, feelings, and so on. How do you see perspectives of drug addictions globally and in Rwandan context in particular? Do you find the collaborative environment facilitating access to healthcare services, especially in mental health and addictions? Mr. Kagawa, the floor is yours.
Yeah, thank you so much, Dinamo. And a lot has been said by my previous colleagues. I will limit to the question. Let me say that as HDI, we've been working for the last, since 2006, so over almost 16 years. And when we started our work, mental health was not a priority from our thinking at the time. But along the way, we realized that if there is something to prioritize, it should be mental health. As you heard, HDI works with a number of marginalized communities, people who are already struggling and facing stigma at community level. We work with women who are involved in sex work. We work with the LGBT community. When I say LGBT, I mean, I don't know how to call it, but I hope people in the room understand. You understand what I'm talking about? Yes or no? LGBT? You understand who I'm referring to? Okay, good. So we work with young people on, especially focusing on sexual and reproductive health rights. We work with drug users. And from my experience, I have seen people losing it because of addiction. Starting with the depression, mental health, and I see a young professional, very smart graduate, going to a level where he or she cannot even afford to have food. And that has influenced our work to some extent. So around 2016, we realized that we need to do something about this. And Rwanda, again, as has been said by Dr. Joel and Dinamo, and probably as you all know, we are one of the countries that cannot shy away from investing in mental health because of the violent history that we went through. I think Rwanda introduced its national mental health policy around 1995. We had to respond to genocide. You've heard globally we have about 20% people with mental health challenges globally. But when it comes to genocide survivors, we are talking about 52%. So Rwanda, as Rwandans, we have no opportunity to just keep away from implementing the right programs because mental health is a real challenge. But as has been said, we have the right, we have put in place the policies, we have put in place some resources are being invested, but we have a huge gap that requires that also the efforts in terms of resources, in terms of what we should be investing in, should also be responding to the current demand and the existing gap. Now, coming back to stigma and how the communities, I still believe that when we look at who should be involved and who should be engaged for that collaborative work to happen, I think we still have some areas that we need to push. Mental health is a challenge that has to be addressed right away from families, from friends. So when I see at most of the responses, we have been medicalized, health facilities, but there is a lot of work that needs to be done at community level because I see every community member being a key stakeholder. The Rwandan community, I believe, still stigmatizes mental health. Still seen, if you're having mental health challenges, it's considered as a sign of weakness. for most people. And that's why it goes to a level where we don't go for screening. We don't know. We don't know if we need some help. And I think we need to invest a lot in terms of community being aware, community being supportive. When it comes to addiction, the first victims, of course, apart from the people who are addicted, is the community, it's the family. One friend of mine was telling me, can you imagine, because we're talking about this, we're talking about mental health, we're talking about when it comes to families, let's go to GBV. Have you imagined the lawyers who are involved in divorce? Do they do counseling? Do you think they do some counseling by their work? Yes, they do. How are we engaging them to have those skills? They are the ones who have all the burden. So I think that we need to identify all the key stakeholders, starting from family, the professionals, the civil society, government, and ensure that we are equipped with the right knowledge and skills to be able to respond. And ensure that we are responding to the community stigma. And the only way to fight stigma is to raise awareness, to ensure that every community member is aware of mental health. And if this happens, we are able to seek healthcare. We are able to have responses that help us to live healthy and destigmatize. Now, coming to the communities we've been working with, one of the challenges we have faced is the awareness to seek services. People are not aware where they can also get services. So we need also to strengthen the outreach. I have seen that currently we have some efforts of health facilities doing some outreach, community screening, and we need to invest more of that. When it comes to drugs and addiction, one of the best approaches we should employ is also to educate young people not to start drugs. And I believe that has to be integrated in all our programs. I believe everyone who is doing some work with communities should have that, because we've seen that it's going to keep increasing. I mean, if you look at the global trends, and as HDI, we are very much interested. We have started some conversation around harm reduction. We do know that as much as we talk about stopping, not starting drugs, not going to addiction, we are also very much aware that some people may be unwilling to stop drugs. And how do we support them? So we need also to think about, in terms of policies, programs that aim at reducing the harm caused by drugs. And that, of course, would require harm reduction interventions. So, which you would need to take us another step to look at the current policies and how we can improve them. We've been struggling with people who are injecting drugs. And some of the intervention that can be done around clean needle exchange programs. We have people who are injecting. Recently, I did a study and we found that the prevalence of HIV among people who are injecting drugs is high. But how do we reach out to these people? It is still a crime. So we also think to look at our policy and legal framework. Should we decriminalize people who use drugs and maybe be able to access them, educate them, support them, give them psychosocial support? The same like what is happening in Iwawa. If you see the numbers that are in Iwawa and the other transit and rehabilitation centers, we find a very high number of our youth. We need to strengthen the response and see how do we work together. Medicalized, spiritually, everyone playing their part to ensure that we are really able to respond to addiction. We need to mobilize resources. We know globally, one of the biggest challenges, one of under-resourced service is mental health. It's not only a problem of Rwanda. Mental health is one of the services that is likely to be last invested in. But it should be one of the priorities because it has to be integrated at all levels of prevention. I was listening to our budget because we had a budget hearing a few weeks ago, and I was looking at all the budget going to construction of, I think, expanding Dera Hospital, and I was like, how much are we investing in mental health awareness? You know, we need to do that. So in terms of collaborative effort, collaborative framework, I think we are on good track. I can say, though we have the right policies, we just need to take a step further and ensure that these policies are implemented and we bring all stakeholders. I think there are so many stakeholders that are not involved that have to come on board. What I have seen from the policy, it calls for multi-sector, multi-involvement of different actors, multi-stakeholder involvement. We've been discussing with institutions like the police, who are very much interested in drugs and security, to see how we work together. And it is one of the, if I look at about 14 institutions, I think, Dinamo, who are involved in the drug response, you could see it brings a lot of stakeholders. What we need to do is just to create more of these spaces and see how can each one of us play our part. How can we do what we can do better so that our different contributions are helping us to move the next level. Our initial engagement has shown us that everyone who have contacted, everyone is aware that this is a challenge. And I'm not a prophet of doom. It's going to be a challenging, it's going to keep increasing. Addiction is going to keep increasing because as development goes on, as global challenges, we have seen what COVID has done. I would wish we don't have any other pandemic. COVID-19 has shown us that we have actually to invest more in mental health. Maybe next time we have another pandemic, we don't know. But this has, this means that we need to work together. We need to play our part. And I think everyone who is involved in the response is quite motivated. I'm happy that we have young people here. Thank you, Rwanda Youth Impact, for organizing this space. I loved when I think it's Osaman who came to my office and it's like, we are looking at addiction, but we are not only looking at drugs, we are also looking at betting, we are looking at social media addiction. And I'm like, okay, this one I had never thought about it. There are also people who are addicted on social media. And that's a huge challenge. If you spend a number of hours every day consuming YouTube, are you delivering at your work? And you can see people who are on their phones 18 hours a day, who are not even able to sleep. And that has impact on what you do. So addiction, we need to look at it broadly. And I think when Rwanda Youth Impact said that, I was like, I'm very actually interested in this conference. I need to be there and hear how we can respond to this. Because it has a lot of challenges, and as I say, some of them are coming, they are context because of the current development. But how do we manage that? How do we, when we say drugs, we think about hard drugs. I think our ministerial order on drugs and classification talks about what the Rwanda government considers as drugs. But alcohol, how many people have you seen who have lost it because of alcohol? Inzoga. Someone who is earning a very good salary, supporting a family, but who can't come to work because of alcohol. So as young people, and I love that this room has young people, we need to think what should be our role. It also includes peer education. We need to be aware. Some of these things, we start them. I was looking at some of the new businesses. I don't know if you've been observing. Kigali is expanding. I've been looking around at some of the new businesses. If you see every new building that has been innovated, what do you see there as the new business? Alcohol. Since we wanna to bari Christian, every new building, some people liquor stores, they are like becoming the new business. I'm like, oh my God. And I'm seated with young people, some of them taking a lot of inzoga ntigeze mbona n'umwana havuga nti no karabaye. You start at 19. Bishop, there is a lot of work to be done. And I'm like, we need people to talk about it. You don't need now to walk a kilometer to get any alcohol. It has penetrated into our home, our families. So how do we deal with that? So I see the role of religious community. So in terms of the stakeholders in drug addiction, I actually see it as an area that requires the diverse stakeholders collaboration, and I think everyone recognizes that. I love this space, and I think we should have more of this space. I think we need a lot of research. We need data. We need to see what is happening. Do we know how the problem is in Rwanda when we're talking about addiction? What does it mean? I've been visiting some of the rehabilitation centers and some of the poor involved in care. Santri Chizere, ndizera ko hena n'abatumiye n'abandi. Children, young people have been, parents have spent their money, taken them to the best high-end education. They come back when they're addicted. From United States, from Britain. So it's a huge problem. I've been talking to parents who have invested. A parent who tells you, I have done everything to educate my child right away, to give my child everything. But mwana araza akambwira ati ndagusohora no navuga ndagukubita mu nzu kubera yasinze. Hari n'ibindi bintu basi nimvuga gusinda ntabwo mvuga inzoga gusa. Hari n'ibindi bintu abantu basigaye mu gisore cyawe rwose kikakunanira cyangwa kikakwirukana no mu nzu yawe. So it's a really a huge problem. And I'm calling each one of us, don't leave this room thinking that this is work for Rwanda Youth Impact or this is work for RBC, this is work for the experts. It is our work. So I'm calling each one of us who are in this room, those who are hearing, who are listening to this work, and I want to appreciate everyone who has supported this conference. And I think, let it be a calling to all of us to re-energize and say, how do we continue working together to respond to this urgent priority? Because I believe as Rwanda, we have gone through a lot. We know mental health is needed, and we need to do everything, including, of course, as Dr. Joel said, allocating adequate resources. I think currently we have about 10% of our budget that goes to mental health, of our health budget. I don't know. But I was looking at something that said about 10% of our health budget goes to mental health. But there is a huge gap, and we need to make it integrated in all our work, and we need to advocate for increased resource allocation, including the private sector. We need to see the private sector investing in this. In a number of countries, people, their staff, if a staff is not mentally stable, they are not going to deliver. Certainly it has a lot of link to economic development, and we want, of course, to go to the next level. Thank you so much, Dinamo. Sorry if I took more time.
Thank you very much, Dr. Kagaba. So I don't know if I can just try to translate something that has been said in English so that our colleagues here who are maybe not good in English can have something. However, Kagaba tried to explain. Yavuze ibintu byinshi. Ariko ikintu cya mbere nuko ikibazo cyo kwita ku buzima bwo mu mutwe ndetse no kuba imbata yikoreshwa ry'ibiyobyabwenge cyangwa no kuba imbata ku koranabuhanga nk'uko bamwe babivuga ni ikibazo gihangayikishije isi. Ariko igishoboka gusa ni kimwe, ni imbaraga za buri wese no guhuza ibikorwa by'inzego zaba iza leta, iz'abikorera na societe civile. Ikindi dufite ubwoba ko impungenge ko ikibazo cy'ubuzima bwo mu mutwe nyuma ya COVID gishobora no kwiyongera igihe hashobora kuba haboneka ibindi byorezo bishobora kugira uruhare mu guhungabanya ubuzima bw'abaturage, bikaba byatuma bamwe batakaza ubuzima no kubura imibereho ikwiriye. Ariko dufite icyizere ko amahirwe ahari yuko izi mbaraga twebwe twazitangiye. Haracyakenewe ubushakashatsi kugira ngo bamenye niki cyakorwa kugira ngo abantu babashe kuva mu bibazo byo mu mutwe no gushyiraho ingamba zikomeye. Ikindi, ntago ibikorwa byo kwita ku buzima bwo mu mutwe bishobora gukorwa gusa n'abantu bahambaye. Birakeneye yuko abantu bagira uruhare mu kugira ngo bakore investment no kwita ku bibazo byo mu mutwe byakorwa na societe civile cyangwa leta, kuko ingengo y'imari ishyirwa mu buzima bwo mu mutwe ku isi yose ni nkeya. Igihugu cyacu nacyo kirimo, dukeneye rero imbaraga za buri muntu wese. Ikindi Dr. Kagaba yavuze, ariko nizera ko tuzagikemurira ahangaha kubera imbaraga z'abajene bari hano, nuko urubyiruko rufite uruhare runini cyane mu kwita kuri bari abantu baba bafite ibibazo no gutuma benshi batishora mu biyobyabwenge. Ikintu cya mbere gikomeye rero giteye impungenge abajene muhamagarirwa no kugiye kureba usanga investment zikorwa zishobora kuza ahubwo zitera ibibazo byo mu mutwe. Aha niho yatangaga urugero rw'ikintu bita inzoga. Mwabyumvise? Inzoga ni kimwe mu bintu bihangayikishije abantu, aho usanga investment ishobora gukorwa akenshi za ijyana muri sanse y'inzoga. Utubari turimo kuvugururwa mu mujyi wa Kigali n'ahandi mwabibonye, sibyo? Murumva ko dukeneye kugira ngo ese ni ryari umuntu azageraho ashobora kubona inzoga ntazinywe ngo zimwice cyangwa zishobora kuba zamugiraho ingaruka. ariko dufite icyizere kuko wenda abajene bari hano bashobora kutanywa inzoga kugeza ku rwego rw'uko zibica, sibyo? So I tried to summarize a bit what you're talking about, but for sure I know that these young people have understood much more than what I was talking about. So if we continue, Professor, how are you? So he's good. So the UN SDGs 2030 has pledged to avoid leaving no one behind in that Agenda 2030. So this agenda has included the promotion of mental health and mental well-being in goals 3, 3.4, 4, 8, 11, and 17 articles. The World Health Assembly in May 2013 adopted the first comprehensive mental health action plan 2013-2020, and which was extended up to 2030, underlining the urgent need to strengthen efforts to address the treatment gap for mental health and neurological disorders, outlining strategies and targets for action in all countries. So, Professor, I think you understand the world commitment and the target and even the resolution outlined. So my question is this. People suffering from mental health and addictions are facing harassment, however this commitment. They are facing stigma and discriminations. These have been all along, and this issue were institutionalized up to investment and financing in mental health, like Dr. Joe, Dr. Kagawa, but with a good response from more BDF. How can the world respond to that challenge? Will the time come that those affected mentally experience holistic life as non-marginalized people? What approaches? How can they access affordable and equity in healthcare services? The floor is yours.
Okay. First of all, thank you so much, Rwanda, for this invitation, and especially Rwandan Youth Impact. Am I audible to everybody? You can hear me? Great. My previous speakers have already mentioned a lot of things, so I will not take much time. But when you get into the flow, you do not see, how much time you're utilizing. Mental health, first of all, it has been my passionate areas because I have studied mental health in school, in college, in higher education. So my field of education has been psychology and mental health. And the reason why I got passionate more about this field is the way it is perceived today. We talk about mental illness, we talk about mental disorders, but we fail to understand that there is a different side to the coin which is called mental well-being. So what my approach has been into working and advocacy has always been moving from illness to wellness. So if we focus on the wellness part, I think we will try to subside the illness part of the coin. Coming to the financing part, which is very important and which we have been advocating, I think, since my organization started in 2016. And we have not seen enough of funds which are being dispersed for mental health cases and mental health issues and mental well-being, and even for the awareness of mental health. The reason why we face problems today is because we do not perceive mental well-being as important. And it is not our problem because we have been conditioned like this in society that mental health is something very synonymous to being crazy or being mad. So that is the reason we do not take it as important, because we are living in a society like this. What more has to be done is to spend the funds or financing or even your human resources is on building that perception that mental health is what you are and your well-being. Just like fever, just like cough cold, just like COVID-19 for example. Mental health is what you are. The figures which we have during our researches and our work with different governments also is that less than 2% of the national budget is spent on, 2% of the national health budget is spent on mental health. And everywhere. It would be slightly more in probably Western countries, but Western countries are no way behind, nowhere ahead of any one of us. Trust me on it. It's the same problem everywhere. Now, what has to be done to get this financing on board is to have a collaborative efforts of public and private partnerships, civil societies, and people like all of us. Coming to the middle income countries and the lower income countries, at least 5% of the budget has to be spent on mental health, and it can go up to 10% to the upper income group countries. Donor financing has to be there, and a clear-cut monitoring has to be done whether the finance has been utilized properly or not. I'll tell you something. When we ask, I mean, we as in any one of us ask for sponsorships or donations or charities for mental health work, for setting up counseling centers, setting up de-addiction centers for that matter. You know what questions we are always faced with? What is your business model? Mental health is not business. Come on. It is your part. We are not here in this business of helping people for a better living and a better psyche. It's not to make profits. There are other ways you can make profits, but mental health is not a business. So that was one of my clear agendas in my organization, that I will not take donations and charities, and neither I will give donations and charities. Because what I am doing is for humanity and for people. Governments, now when I talk about governments, government is built by all of us because we go and vote. They have to prioritize mental health, especially after COVID-19. Mental health in any government sector, whether it's in any continent, you go to Western, African, Asian, Middle East, it is a secondary healthcare sector. Mental health has to be a part of primary healthcare. And that is where it will gain attention. Just recently, 2 weeks ago, if you have noticed, Kenya has passed a mental health bill. They have revised the mental health bill. I was on the board. So they have made a new mental health bill in which the financing of mental health professionals and to the civil societies will be more now. Which is a good step, which is a very good step in fact. So this is how we have to start taking care of this aspect and this area. Mental health also has to be integrated with the ongoing reforms in any department of government. Whether it's social affairs, whether it's education, health obviously, whether it's labor, whether it's any policy, mental health is a part of all these ongoing reforms. And also, I would urge, I mean, if BDF is here and other agencies are here, mental health has to be a part of insurances. Insurances do not cover mental health services. That is the reason it is not being accessible and approached by many people who actually know that they need help, but cannot afford. The reason of inequality is because every second person, now this is something which I have faced in my life, every second person on this planet becomes a counselor. We can counsel. We are a psychologist, or we are in a helping profession. A person who has studied for 10 years, got trained, versus a person who just studies like a 3-month certificate course in counseling and becomes a counselor. That clear indication is not there. So the fees The counseling session fees, I'm just talking about general how financing can be done. The counseling session fees, people are just charging what they want. Especially in India, I am fed up of all these things. Per session, they charge $200, $300. Someone is charging 100, someone is charging 150. Because there is no clear-cut roadmap or no clear-cut monitoring as to how we have to utilize this kind of service. And that is the reason many people are not able to access it. Last year on the World Mental Health Day, if everybody knows 10th October is the World Mental Health Day, they said that mental health has to be accessible and approachable to all. And when I say all, doesn't mean that person who's suffering from a mental health issue, but for everyone. Even I can face issues at one point of time. I might be very much stressed. I need to talk to someone. If my friends are not available, my family is probably not able to understand, I need to go and access a mental health professional who can actually listen to me. And that can actually solve my problem. But people do not know this. Why? Because our society is not conditioned for all these things. A simple thing, men should not cry. Men are not emotional. These are small things in society where we are living which needs to change and which actually attacks your mental health. Your psyche gets conditioned like that. So this financing part is important, but it will come at a later stage, sir, when we all are aware that there is something called mental health, which is very important. When you say United Nations 2030 agenda, United Nations states that it is the decade of action. In this 7.5 years which are now left, we will prove to ourselves that are we capable of living on this planet or not. And everything surrounds your mental well-being. And the connotation of mental health has to change. It is more of taking care of yourself. You know, when a small intervention with a friend or a family, if you see that the person is not right up to the mood, can actually help the person of getting into deep shithole of mental illness. That slight intervention is just a threshold line which we need to be aware of. And that is mental well-being. And that is what I do. Today, on my organization, Peaceful Mind is the broader umbrella. The under segment of it is World Leaders for Mental Health. World Leaders of Mental Health today has 75 policymakers on board from every part of the world, who are actually framing a policy on global mental well-being with us, which will be submitted to the WHO coming 10th October 2022. So these 75 people who I have approached, collected, are not from the field of mental health or who are not from the field of even health. They are parliamentarians, sitting prime ministers, presidents, ministers, who are actually supporting that there has to be positive mental health for their own citizens. Well-being diplomacy is something new which I started off just in 2020. People have to know each other and they have to respect each other's well-being. And that is what diplomacy is. Finance, infrastructure, trade, commerce, culture is there, yes. But what about my well-being and your well-being? When I nurture you and you nurture me. So that is the broad connotation of mental health which I have experienced and which I am advocating worldwide wherever I travel. And it's a huge passion, it's a huge honor because at least we have a platform to speak and to execute. From this panel also, I am very much hopeful that it is not just speaking. We have to execute something on ground, and that is where the difference will come. So thank you so much for this question, sir. And yeah.
Thank you, Professor. Let me try to explain a bit what you have been talking about. So ikintu cya mbere yavuze ni bikeya muri byinshi, ariko no kugira ngo babandi wenda tujyane, arifuza ko ni ukuzuza ibiganiro byatanzwe n'abandi, ariko arifuza ko tugomba kuva kuri rwo kuvuga ngo umurwayi wo mu mutwe, ahubwo tugire ku rwego rwo kuvuga kubaho neza ku bijyanye n'ubuzima bwo mu mutwe, sibyo? Hanyuma ikindi, ntabwo ibi bishobora kugerwaho na rimwe hatabayeho uruhare rw'abakomeye. Ubundi abakomeye hari urubyiruko, uruhare rw'abakomeye ni urubyiruko. Yavuze ba perezida b'ibihugu, avuga abayobozi bakuru, avuga aba advocates n'abandi, ariko ngiye nkongeraho n'urubyiruko. Hanyuma igitangaje giteye inkeke ni uko yanatwibukije ko nta hantu na hamwe ku isi batera inkunga ku bibazo bijyanye no kwita ku buzima bwo mu mutwe, ndetse na organization yiwe yagize ibyo bibazo bimeze uko nguko. Ariko ku isi hose niko bimeze, kubera ko mental health interventions zidafatwa nka business zunguka, sibyo? Ahubwo ni uburyo bwo kugira ubumuntu. Ariko aravuga ati gikenewe gukora, from Dr. Joel, Dr. Kagaba, Mr. Eddie, even Professor yavuze ko collaboration ni ingenzi hagati y'inzego zose. Ubufatanye ni ingenzi mu nzego zose, ariko yongeyeho n'ikindi kintu cyiza cy'uko hagomba no gushyirwaho imbaraga mu guhuza abagenerwa bikorwa. No kuvuga ngo bari abantu tubona bafite ibibazo byo mu mutwe, ndetse n'ababaye imbata yikoreshwa ry'ibiyobyabwenge cyangwa inzoga. Ariko twe nk'urubyiruko turakangurirwa guhindura imyumvire ipfuye abantu bafite ku bijyanye no kwita ku buzima bwo mu mutwe, ndetse hakenewe uruhare rwanyu mu kugira ngo mugire investment, mugire ishoramari mu bijyanye no kwita ku buzima bwo mu mutwe. Icyiza twe nk'igihugu cyacu dufite dushobora nko kurata nuko dufite uguhuza ibikorwa by'ubuvuzi bukomatanyije, harimo no kwita ku buzima bwo mu mutwe, icyo twita integration ya mental health services mu zindi serivisi zisanzwe. Ikindi gikomeye nuko ubwishingizi ku bijyanye no kwita ku buzima bwo mu mutwe mu Rwanda twebwe turabifite ku nzego zose. Icyo kintu mwagihaye amashyi. Hanyuma ikindi ni uruhare rwa buri muntu. Uruhare rwa buri muntu nta ruhare ruba rutoye. Yavuze ko participation of everybody, ubufatanye bwa buri muntu no kugira uruhare mu gukemura ibibazo by'ubuzima bwo mu mutwe no kurwanya ikibazo cy'ibiyobyabwenge no kuba imbata y'ibiyobyabwenge, ni uruhare rwa buri muntu, kuko nta muntu umwe ku isi ushobora kuzabona kiriya gisubizo, by'umwihariko mu gihugu cyacu. That was the summary of what the professor was talking about. It's a good message, and I'm requesting clap for you. So we still have one speaker. As I said, Miss Ilem Adseva from Turkey. I need someone to link us with her so that we may have one important question to ask.
Can you see the screen?
Yes, we can see your screen.
Okay, thank you. Thank you for your support. Okay. I have worked at Green Crescent Counseling Center, which is called YEDAM, for 3 years. And I'm a clinical psychologist, and today I would like to talk about our projects, rehabilitation projects on addiction. And I would like to start my presentations talking about a brief history of the Green Crescents. And Green Crescent Society was founded under the name of Lale Ahtar in order to fight against alcohol addiction in 1920. And after that, when we came today, intervention and rehabilitation services were included besides the existing protective and preventative activities of the Green Crescent. And by the way, the Green Crescent is the first non-governmental organization which fights against all addictions in the world. And now, rehabilitation activities of us. As I said, Green Crescent Consultancy Centers, YEDAM, we have. It's aimed to provide free psychological and social support to people having problems in alcohol and substance use and their families. And trained psychologists and social workers are involved in the YEDAM team. And YEDAM was founded in 2013, and it began to provide call center service in the first step through information hotline, and then established in Üsküdar, Cerrahpaşa, Başakşehir, in Istanbul. And recently, YEDAM centers are available all over Turkey. This model is quite important for us because it's developed according to Turkish culture, values. And here is our map. This is the map of Turkey, and these points are our locations. Now we have 105 YEDAM centers in Turkey. This is one of our buildings in Istanbul. I guess it's the biggest one. And another example.
So excuse me, Miss Mem. I'd like to ask. I'd
team
like
of
to
YEDAM,
ask if you may have some slides.
Public relations specialists, clinical psychologists, and social service specialists
Hello.
in a YEDAM center.
Hello.
Number of specialists are changeable according to the needs. And
We're not seeing your slides, please.
this is
If you have slides.
YEDAM in figures. You can see our services number we met until now.
We're seeing anything.
These are current statistics.
We are seeing anything.
And our working areas. In the beginning, YEDAM services only meets alcohol and drug addiction. And in the time, other types of addictions were added, such as tobacco, gambling, and technology. And these 5 issues bring into existence of our working fields. And we provide the clients with a psychosocial treatment plan, personalized intervention, and directing to medical treatment and monitoring. Oh, really? Is it moving or not? Okay. How can I do it?
I'd like to request you to start. We have been waiting for the slides and.
How can I do it?
Yes, please start. Now we can see slides.
Is it okay now?
Yes, then make full screen.
Okay. So we are continuing.
Yes, please continue.
Okay, thank you for your support. These are our working areas, as I mentioned before, and this is our services, what we provide for our clients: psychosocial treatment plan, personalized intervention, and directing to medical treatment and monitoring. Okay. And our practice is under supervision, and we have a structured system. And these are some examples of our materials, what we use with our clients. And these are scientific publications. YEDAM not only offers consultancy service, but also do scientific research and publications. And these are some examples of what are we services YEDAM, what are the services YEDAM provides? Firstly, psychotherapy, face-to-face interviews performed with individuals having alcohol and drug problem, and family interview. Interviews performed with families and individuals who applied to YEDAM. It's important to arrange intra-family relations, actually, and our group therapy services. The interviews supportive for treatments, where the people coming to psychotherapy interviews come together, and which is based on informing and sharing their experience and knowledge about addiction for our clients again. And for their families, family group therapy, the interview supportive for treatments, where families of the people coming to psychotherapy interviews come together, and which is based on informing and sharing again their knowledge and experience. And social support. The social support provided to people having psychotherapy process in YEDAM is important on social adaptation of person, and it contains activities such as guidance to find job through Turkish Employment Agency, to support training process, to organize social activities, and guidance to courses for hobby and skills, to support for social security. And YEDAM workshop. YEDAM workshop is therapy through profession step of YEDAM model, aiming at optimal participation individual to society. The purpose is to provide individuals stay clean by developing their hobby, profession skills, to increase their adaptation to society, to support them on having a profession, and to enable them be a producer individuals in the society. And you can see our workshop activities. Which workshops are included? It's an outpatient rehabilitation center established for people who receive a treatment for alcohol or substance addiction, or who have completed treatment and stay clean again. Handicrafts workshop, gastronomy workshop, graphic design workshop, and sports and health life workshop. And the workshop aims to improve the professional competences of the clients, and to bring them to position of producing by supporting their social integration again. This is one of our important services for our clients. And these are some messages from the family of individuals with dependence. Actually, these are our biggest motivation. I want to say something about it. Here is one of the examples. When my dad stayed clean, I noticed for the first time that he was the dad. Thank you, YEDAM. I used to wait for my son to come home before going to bed. Thanks to you, I can sleep peacefully now. It belongs to a mom of addicts. As I said, our service includes an outpatient services, but at service soon, inpatient. This is our inpatient treatment service, and at service soon, inpatient treatment service, and our 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 inpatient treatment buildings in Bursa Rehabilitation Center, and Diyarbakır Rehabilitation Center again. Thanks for listening.
Thank you very
And-
much. So many clubs to us.
Connection problem.
So we have listened from her. But thank you for the good presentation and the opportunity to raise that know-how in Turkey that you are implementing rehabilitation process and your interventions toward mental health and addictions. But I want to thank you very much and try to translate a bit what I have just tried to listen from to this audience in Kinyarwanda. Uriya mushiki wacu yatubwiraga uburyo iwabo bakora processes uburyo bagerageza kwita ku bantu baba barabaye imbata y'inzoga n'ibiyobyabwenge, ariko cyane cyane yavuze ko bo bibanda cyane kuri alcohol, nicyo kiyobyabwenge cya mbere kiri iwabo, ni nayo ntangiriro yo gukora Green Crescent, ariko cyane cyane ku nzoga, ikibazo cy'inzoga ndetse itabi, ariko hakiyongeraho noneho ikibazo ngira ngo cyavuzwe na Dr. Joel kijyanye na addiction to technology. Mu bihugu byabo biriya birahari, ariko avuga yuko ikindi bagerageza gukora kugira ngo bahite kuri abo bantu, ariko bagakora n'ubushakashatsi. Arongera avuga ko kwita kuri bariya bantu bisaba ubuhanga n'ubundi bumenyi buhanitse, hari ibyo n'ibyo twebwe dufite mu Rwanda, aho navuga nko gushyiraho support groups ndetse na individual therapies, uburyo bwo gufasha abantu babahuriza hamwe bakaganira ku bibazo byabo ndetse rimwe na rimwe bakagira uruhare mu gushaka ibisubizo by'ibibazo bafite. Ariko yagarutse ku kintu kiza, avuga icyo bita social support, uburyo ubufatanye guhera mu muryango kugera muri community hanze kugera kuri societe itandukanye, uburyo abantu bagomba gufashanya kugira ngo bite kuri uriya muntu. Yongeye atwereka ko rehabilitation process iri mu gihugu cyacu, uburyo bita ku bantu baba barabaye imbata y'inzoga ndetse n'ibiyobyabwenge, ni uburyo buhuriweho kandi bwemewe dukoresha, ahubwo urabona ko dukeneye ko dufatanya nabo, kuko mu Rwanda rehabilitation yacu uko ikorwa n'abahungira ngo mwabonye ko wenda dutandukaniye kuri infrastructure, ariko uburyo bikorwa ni kimwe n'ibyacu. Yagarutse ku kindi kintu cyitwa gufasha abantu baba baramaze guhura n'ikibazo cy'ikoreshwa ry'inzoga n'ibiyobyabwenge, avuga ko kubitaho harimo kubafasha kuva mu bukene, harimo job creation. I think that it's a good opportunity to work with the BDF, as long as Mr. Edi has said that they are establishing partnership and collaboration with everyone to make sure that he has access to financial means. Urumva ko ari ibintu byiza, ndetse no muri employment opportunities, guha akazi abantu baba baramaze kuva mu biyobyabwenge cyangwa se kuva mu kuzahazwa n'inzoga. Ngira ngo nibyo ngibyo yaramaze kutubwira. Nkatekereza ko aba presenters bacu, I thank everyone here who has been speaking. Thank you very much for the panelists. And I think, if I'm not wrong, this is the time to give microphones to the audience, especially those young people who may ask some questions or maybe comment, providing inputs, and everyone in the audience to make sure that these experts from different domains, healthcare providers, civil society organizations, health financing opportunities like a BDF, and experts, especially in investment of mental health, so that everyone here can have the floor, and these experts are ready to respond to any of the questions and comments. The floor is yours. MC?
Thank you so much, the panelists and the moderator. Let's give a round of applause to the team, the panelists and the moderator. So maybe we can take maybe 5 questions, maybe from the audience. Any 5 questions, maybe to those who were beauty. Can you maybe take a microphone? Maybe 1 or 2 from the youth, maybe we might get some questions. Feel free even to ask in Kinyarwanda. We'll answer it also There is a man there. He needs. Please, when we are here, we are a family. Feel free. Whatever we discuss here remains here. We become a family. Thank you. Let's hear from the first question. You can stand up. You say your name. Then we also hear your contribution.
Okay, thank you. My name is Yves Jean de la Croix Umuhoza Blando. I have a question and also an advice. Here, as we are, do you see that here among of us we are the youth? But the many problem we have after to face with COVID-19, many youth they became unemployment because of those pandemic. So and then after those pandemics, they lost the supports because everything has changed, and in the mental they distracted. But I have an idea that I would like to ask the BDF presenter that they can support us for starting a business again according to ubumenyingiro dufite, sibyo? Ariko nanone nkongera nkaba nabaza ikibazo cya kabiri. Nk'ubu ngubu nge naje nturutse mu itsinda bita Umugozi Group. Dukora ibintu bijyanye n'ubujyanama mu kurwanya addiction, like nk'urubyiruko nyine rukunda gukoresha ibiyobyabwenge cyangwa se babaye addicted ku ikoranabuhanga. Ariko ibyo ngibyo tukabinyuza muri entertainment. Dukora amafilme, hari na filme yitwa The Second Chances turimo dukora, ariko ikintu gihari turi kubura ni ikintu kijyanye na financial support. So ubwo rero tukaba twari turimo twibaza duti ese nubuhe bufasha mwaduhereza bwo kugira ngo iyo filme tuyishyire hanze, ko irimo isomo ryo kugira ngo n'abandi bantu bakoresheje ibyo biyobyabwenge babashe kuba babireka, ndetse tubashe no kuba twayerekana mu mashuri, kubera ko niyo target yacu dufite. Murakoze.
Thank you, Murakoze Chani. Maybe we will just get maybe another question, then the answer once. Okay, you can give the microphone, then we just get one question, then we'll still have some more time after the lunch for question and answer, but for now maybe we can take 2 questions because of time. We want to go to other sessions, so you can ask maybe 1 minute or 2, then we give the panelists to answer. Thank you.
Thank you so much. My name is Manuel Jean Bosco. My question is this. There are many rural communities who have no channel for information about how to mitigate the health mental impacts. I would like to ask the Rwanda Youth Impact representative, how are they working with those people to help them mitigating those impacts and helping those who have already addicted with drugs abuse to feel comfortable, to reduce that stigma in their society where they live. Thank you.
Thank you so much. That question is directed to Rwanda Youth Impact. I think they will be having a session which they will answer, so stay tuned. They are going to answer that one, but for now, we'll allow the panelists here present, BDF and the other panelists who are here. So we take the last question or contribution. Yes.
Thank you. My name is Charles. I'm from Prime TV. So I think many people have been affected by COVID-19, and I think it's quite evident. So I wanted to just find out, maybe I also came late, so maybe I'd like to also just, you'd also like to explain that. What maybe position is BDF or any of the other partners taking to help the youth get back on their feet? This, of course, I'm asking now as a journalist and also as a media owner, and having people coming maybe with shows, having people coming with different ideas that can actually help people with mental illness, but we on this side are limited because of financing, because we cannot finance that great idea. So maybe is the government open, or BDF or any of the stakeholders here, are they open to partnering with media houses and young people so that people can be able to share some stories or share some content which can be able to help people? Thank you.
Thank you, thank you. So I give you the panelists the time to answer these questions. Thank you, panelists. Anyone from the panelists who can answer all those questions which have been directed to you? Thank you.
Thank you, the MC, and to the audience for the questions. When it comes to financing, I'm ready to meet a lot of the questions. But that's why I'm here. The first question is from Eve. Eve asked about BDF support on the skills, the support we have for those with the skills after the pandemic. And it has something in common with someone from the Prime TV, Charles. So I did not mention during my first, I did not mention about the Economic Recovery Fund. So the Economic Recovery Fund is all about improving our businesses after the pandemic. So we are on the phase 2. We concluded with the Economic Recovery Fund phase 1. So we are starting the Economic Recovery Fund phase 2. And BDF will play 2 roles. Role number 1, BDF will, we have already signed with SACCOs, SACCOs around the country, where we are focusing on small and medium enterprises that comes from around the country. So it's a fund that BDF passes through the SACCOs. So then after the clients of SACCOs, or those people who want to benefit from the fund, can work with the SACCOs, request for money, and BDF will give that money to the project owners through SACCOs. So it's about the information that I should have given out, that the Economic Recovery Fund is already out, phase 2, to support those ideas that you have, and it's open in all sectors. Please make sure that you benefit on this fund. Another role that we play on this is the role of covering the guarantee cover, the collateral part. This is open to all financial institutions where the banks will apply for the funds from BLRD, and BDF will cover the part of the collateral. So we are covering the part of the collateral, and we're also giving out the funds. So that is a government fund that is implemented through BDF and BLRD. So when it comes to those businesses that you have that were affected by the pandemic, please go out and access those funds we are ready to help you through that fund. So on the media, you said there are good ideas that the media houses cannot afford to air out without help from BDF or from the government. So for us, we are open, bring the business and we discuss and we see how we can help depending on mostly when you come in what we do in the areas that we work in. That is access to finance as our mandate. So we always receive requests from the media. So if you have a business deal that you feel like you can do with business with BDF, we are open to discuss. So those are the questions that BDF had to answer. Thank you.
Murakoze bari bifuje yuko mwajya musubiza no mu Kinyarwanda kugira ngo babashe kubyumva neza kurushaho. Murakoze.
I think Dr. Joe want to respond to the question.
Yeah, I wanted to add a comment on the question that was asked around opportunities for the youth to be supported for business and so forth, and linking to the last presenter talking about rehabilitation. I wanted to give an example on how, I'll come back to the opportunity for business later, but I just wanted to give an example on how even globally, for financing opportunity, people looked at the priority in a very siloed way, in a very, constrained way. We had a partner who was a private global company, a corporate, who was very interested about mental health and wanted to support our programs. Our programs focus mainly on decentralizing health services, getting health services closer to the community, at health center and community in rural places. It's basically supporting the Ministry of Health in the effort to decentralize. And we had incorporated close to more than 7,000 patients at health center level who are followed for major mental health conditions, and 30% of them are below 25 years old in that situation. So for us, one of the key component and we consider that as treatment, one of the key component of the treatment of the support is really social support and rehabilitation. Because we see in issues related to mental health as a component where people are struggling with hope about the future. And once you can rebuild that hope and confidence, you are actually strengthening the person's mental health alongside medication, psychotherapy, and other things that you provide. So when you proposed that to the partner, they looked at it and was like, yeah, we like the treatment component, we like the nurse psychiatrists that we are hiring, but we want to focus on training and evaluation. We cannot support rehabilitation and social support. We push for it. The reason of some of the partners to refuse that is because it's extremely expensive. But then, if you consider that as a key element without which you cannot get the impact that you need on the patients, it's a priority. It has to be supported. So they refused to support us financially for that. We said, okay, even if you can support 20% of our project budget, we welcome that 20%, we'll cover the remaining ourselves. Difficultly, we did. Then recently, their CEO and some other head within their corporate came to visit us. They went to Kirehe, saw a group of patients that we supported doing, because what you realize with some conditions is that people are very good into creative aspect of business. So they did painting and imigongo and so forth. And you could see them really, enjoying the product of their hands and also the income. So these people came, they visited, we showed them the clinic, what they supported, and we brought them to that project and said, this one, you refuse to support. We also had to nail them a bit. Mwanze kuvisupportinga, twarabikoze, ariko look at the impact and so forth. Then later, as we were debriefing, their CEO came to us and said, listen, the highlight of our visit was actually the rehabilitation and social support project aspect. And we are sorry that we did not listen to you, but we thank you that you did not listen to us and supported it. So I just wanted to highlight that it's a difficult aspect to support for one reason, people being siloed in the way they prioritize. The second aspect where people get siloed in the way they prioritize is also there's other actors like, like the BDF and others who actually invest in those areas. But I think there's a lot that could be benefited even from BDF and others who provide support financially to work with healthcare professionals to understand the particularity of mental health. Because the reality is, if I use the example of athletes, an athlete who is a professional competing in a professional setting, once they get injured, they go through a long process of rehabilitation that require them to strengthen their muscles slowly, that require them to build back their confidence and trust before they go back to the professional league. So if a finance support comes to support youth that have got addicted, struggled with addiction and so forth, the same way they will support any other youth, it's already an unfair competition going on there. Because the person who has been struggling with certain mental health conditions will require a combined support through the business that they're having. So what type of business can we really support, and how do we support that? We know in mental health, when you're putting someone the weight of responsibility as they're struggling with their depression and so forth, it actually sometimes worsens their condition. What would the weight of paying a loan have an impact on that mental health, on that patient that had a mental health condition? What is the model that we can support to make sure that either providing a seed grant free from loan, then a growth grant that would have a loan component to pay and so forth. So how do we have the healthcare professionals and even the youth themselves sitting with people who are taking decisions on how to support financially to design what type of support will fit better? I think that component would be extremely important. Icyo nayo mvuze nuko biba byiza yuko n'abatekereza gukora support nyeka yuko even nuko mbivuga most of our team are here, we also even ourselves need to do a little bit more effort on that. Yo tujye guhitamo support project tujye gufasha abagize ibibazo bya mental health and so forth. How do we partner with them in understanding what they can do? Nibyo bashobora guprioritize n'uburyo ki tubikora. Nandi ma finance institutions nabyo abafasha niba dufite aba youth that have been struggling with addiction. Even the way we use words, I mean, yuvuze umuntu ngo ni addicts, it has some negative connotation. But if you uvuze uti there's a person who struggled with addiction, it has a different connotation. So how do we train ourselves to have that broad view and to welcome the people themselves and the healthcare professionals themselves in whatever financing and social support project that we're developing for rehabilitation is extremely important. That's what I wanted to add. Thank you.
Yeah, I'll just add a few comments on the work that we are doing. Of course, psychosocial support is what part of what we are offering as an organization, psychosocial support within our limited capacity, but also the advocacy work to ensure that the policy and programs around harm reduction are initiated. But I wanted to make a comment on the question by the colleague from media. Prime TV ni YouTube TV, the television. Yes, we have observed with mental health and COVID-19, and this is something I'm sharing for the benefit of people who work in the media, that we have observed that in the past 2 years, social media mainly has been exploiting mental health, and this is a very big concern. I don't know if you've been following people, families going through challenges, sharing their personal stories, maybe how they are living, sharing most intimate information that should be shared within counseling rooms. And this is happening by a person probably who is unstable, yeah? Who is not well, who doesn't have mental well-being. And social media is capturing it, sharing it for views. It's quite unfortunate. I believe that this is exploitation, and there's some responsibility. In COVID-19, we have observed so many stories on former LGBT who have changed. Because you brought people into a house and you're giving them 10,000 and maybe there is no food, they are happy to agree to say, umuntu yavuye mu butinganyi yahindutse. Ejo ukongera ukabona byahindutse, umuntu akabishyira kuri YouTube. Sex workers, these are mothers sharing how they do sex work. And media is capturing it. Social media putting, so ibyo nani mukuvuga nuko hari trend twabonye abantu cyane cyane muri media barimo ku exploitinga nabyita mental health ku bantu batandukanye, ukabifata ukabishyira kuri social media kugira ngo ubone YouTube views, kandi mu by'ukuri ubona ko umuntu urimo kuvugana nawe ashobora kuba atameze neza. Ni responsibility yawe nk'umuntu ukora munyamakuru kubona n'umuntu w'ibyo akubwira ukabona ko atameze neza, kuba wamurifaringa ukamugira inama akajya hehe kwa muganga. Niyo mpamvu buriya aba counselors bagiyeho, ntabwo ibintu byose umuntu abigira. Twagiye tubibona cyane cyane muri kino gihe cya covid twarabibonye cyane. Ntabwo nzi niba ariko bihuye nuko na technology advances cyane, ariko twabonye cases nyinshi kandi nange murazibona. Family ifite ibibazo yirimo kuvuga ari amakuru, hari abana, hari abandi bantu, hari ibyo uvuze kubera ko utameze neza, waramutse ubabaye, uri deprime, ukabishyira kuri YouTube. Kuko YouTube ntabwo bisibangana, byagombye kuba bibera muri kuba counselors, nkabibwira umupasiteri wanjye, nkabibwira counselor urimo kumfasha, nkabibwira. Ariko turimo turabivuga YouTube byo irasa nkaho igira gute ibi profita, irabicuruza. So nkavuga nti abantu bari muri media, you have a responsibility. You cannot take advantage of someone's mental health status for views. You have to be, ugomba kureba wa muntu urimo kuvugisha ese ameze neza cyangwa mwohereza. Ndabizi ko umuntu tuvuga yuko ugiye gufata story y'umuntu wagombye kubanza kubona consent, ariko iyo umuntu ubona ko afite ikibazo wagombye kubireba. And I think maybe in the future we need to see how would we train these people, how would we, because I believe you have a responsibility. Yes, you're looking for views, but if you're exploiting my mental health status to get your views, it's very unfortunate. We have to be responsible citizens and give support instead of just spreading it. We have seen it with sex workers, with LGBT, with the families, and it is on the, if you follow YouTube, you're going to see a lot of these things that are happening. Especially, it has been an increasing trend with COVID-19. And we are getting so many people sharing their personal story that maybe they should be talking to someone more private and get response. So people from media, maybe I don't know what we have to do, but as HDI we have been working closely with media, including the capacity building. We've been working with media in the area of sexual reproductive health, and we are certainly looking into how do we work closely with media. If a media institution has something educative, we are ready to work together and see how we can support that. So let's work more together, because media, you have a key role. You have a key role in fighting stigma. The programs you're doing, they call out people, create spaces. Let's discuss this so that we really create an enabling environment where all of us cannot really can have to enjoy mental health well-being. Thank you.
Moderator arashaka kugira comment akora mu Kinyarwanda, hanyuma nta bindi bibazo twakira kuko turaza kugira undi mwanya uhagije wo koza ibibazo. Twakererewe, hakagombye kuba harimo ikindi kiganiro. Turahita dukomeza.
Okay, it's nashakaga guhuza ibyo Dr. Joel na Dr. Kagaba bavuze kuko bimeze nk'ari conclusion itari mbi. Dr. Joel yavugaga ko ni byiza ntimutinye ku investinga muri mental health, ariko cyane cyane bigizwemo uruhare n'abo bantu bafite ibibazo byo mu mutwe. Ubwo nukuvuga ngo hakenewe ko baba integrated, bakaba involved muri programme zose mwa mukora, kuko iyo bagiriye icyizere bashaka kugira uruhare mu kwiteza imbere no guteza uruhare bagenzi babo. Yatanze urugero, aravuga ko hari programme bigeze guteza imbere, hari abantu babasabye support ariko baratinda, batinze basanga bo barayikoze. Baravuga bati iyo tuza kuba twarabonye support from UN financial n'ubundi buri dushaka kuba tutari tugeza ahangaha. Nuvuga ngo dukeneye ko dufasha bari abantu bafite ibibazo byo mu mutwe aho bari, tukabagirira icyizere, cyane cyane ndavuga abantu bajene baba bavuye muri za rehabilitation centers na za transit, ubafashije kuva muri biriya bibazo uburimo kubarinda kuzongera kubisubiramo. icya nyuma ngira ngo Dr. Kagaba avuze cy'ingenzi nacyo ni ikintu kijyanye no kuvuga ngo mukora ishoramari bijyanye no kwita ku buzima bwo mu mutwe, kurwanya ikoreshwa ry'ibiyobyabwenge, ariko to respecta umuntu as human right. Kuko nimuramuka munakoze itangazamakuru ryiza cyane cyane abakoresha YouTube n'abandi mu buryo buri digital investment, mukabikora neza mukurikije ubunyamwuga, nibwo buryo bwo kubona inkunga zituruka mu bikorwa byanyu no kugira ngo mugirirwe icyizere mu byo mukora. No kuvuga ngo hagomba kubaho ngira ngo yataza na pledge yavuze ko rwose guhugura abanyamakuru n'abandi bakoresha ibyo byose HDI retire kuba yabikora kugira ngo bafashe abanyamakuru collecting inkuru nziza zifasha muri promotion ya mental health ariko zitarimo exploitation y'abo bantu. Sibyo? Numvaga ari yo comment nari mfite mu Shyaka. Thank you.
Murakoze cyane, mureke dushimire aba panelists bacu ku kiganiro cyiza bamaze kutugezaho. Wali mu kanya gato tureta dukomeza with the next session.
So, ladies and gentlemen, let's give a round of applause again to the panelists in the house as they take their seats back. Let's give